Well, hey, everybody, this is Robert, and welcome to Outbreak News Interviews. Now, researchers from the Texas A&M College of Veterinary Medicine and Biomedical Sciences are closer to developing an oral vaccine for anthrax, as demonstrated in a recent study in the Journal of Zoo and Wildlife Medicine. So joining me today to discuss this development is Chase Nunez, MS, PhD, Jamie Benn, PhD, AWB, and Walter Cook, PhD, DVM. Welcome all to the program. I appreciate it.
Thank you for having us.
Absolutely.
All right. Okay, excellent. Very interesting research that you guys are doing, and on a clearly on a practical, pragmatic level, it's definitely necessary. Let's go and start with Dr. Cook. I've had podcasts on anthrax in the past, but I still want to go ahead for people who haven't listened to those in the past. Let's start with a little overview about anthrax in animals, both livestock and wildlife, for the audience. Things like pathology and how it spreads, and anything else you want to add, sir.
Sure. And thank you again, Robert. Well, anthrax is a bacteria, and it exists in two forms. When it's in the host, it exists in what we call the vegetative form. And that form is the form of bacteria that multiplies, and in the process, it also produces toxins. And those toxins are ultimately what lead to the clinical signs that you see in animals and in their death. When the animal does die and that carcass gets opened either by a scavenger or predator or by an unwitting human that come along and open that carcass, in any case, those anthrax bacteria get exposed to the environment, and then they convert to a spore form. And that spore form is highly resistant. It can remain in the soil for decades, probably even centuries. And so when that happens, of course, then the soil gets contaminated and sets the stage for another outbreak. When an animal, typically we see outbreaks most commonly in the herbivores, so your cattle, sheep, goats, as well as your wildlife like deer and antelope and those kind of species. When they ingest this bacteria, it usually takes 3 to 7 days for them to start showing clinical signs. And oftentimes they just die so quickly that that's the first thing you see. Before you even notice that they're sick, they're dead. Sometimes they'll linger on longer than that, and you might see an animal, particularly in livestock, an animal that's depressed, that has respiratory distress, labored breathing. If you're able to take their temperature, they could have a very high fever, and they may stagger around, have convulsions, and then notably bloody discharges, often from the nose, the mouth, the anus, and any of their body orifices. And so then again, when that animal dies, those bacteria become the spore form and set the stage for another outbreak. And in Texas, we most commonly see outbreaks after a mild, wet spring that's followed by a hot, dry summer. And Dr. Nunez can fill you in more on that if you're interested.
Okay, perfect. And the key takeaway here is the spore form. So as we move on, Dr. Nunez, where is anthrax an issue here in the United States? Obviously Texas, but where else in the country?
So, like you said, Texas is one that sees quite frequently, a lot of the outbreaks that we hear about. It's all up and down the Midwest, and really, there's been some modeling that's shown anywhere with really calciferous limestone type soils can potentially harbor the pathogen naturally. Because like Dr. Cook was saying, it naturally exists in the soil. So, that being said, we see it in Texas. We see it quite often in what's called the Anthrax Triangle, which is it's an area that, you have to think pretty obscurely to see the triangle, but it's basically from around the Uvalde area down to around Eagle Pass and kind of northwest up to around Sonora, Ozona area. That being said, it's been seen well outside of there. In Texas, we back in 2020 and 2021, we actually had a couple of outbreaks up in the Panhandle, which were several hundred miles from the typical anthrax triangle, and those were in, I think it was Briscoe, Armstrong, and Hardeman County. and that was the first time that they'd seen anthrax there in several decades. There's also, I would say, the other biggest hotspot in the United States is up in the greater Yellowstone area. There's quite a bit of anthrax outbreaks there, and recently there was just another, this past year, an outbreak in Wyoming that was kind of a shock to the medical examiners or the veterinary folks that were dealing with that up there. It's not that they don't see it; they just didn't see it very often in the area where it was found. Utah has seen some cases in the last decade or so, and trying to think of where else. Y'all help me out if you think of something that I missed.
You already mentioned Montana.
Yeah.
Yeah.
Canada.
Yeah, Canada down to Mexico, and even then into Central America. There's the modelers I was talking about was a group from the University of Florida, and they showed that there's basically the correct soil type to harbor anthrax all the way from the Canadian Yukon down into Central America, and it's just a big belt of limestone that kind of follows the edge of the Rockies. So, anywhere that there is limestone, there could potentially be anthrax living naturally in the soil. It's just whether or not it's prevalent enough to be seen.
Yeah. I know frequently I report on cases north of the border in Canada, and sometimes very large outbreaks in bison. And
Wood Bison National Park had
Yeah.
a hellacious outbreak a few years ago.
So, Dr. Nunez, in 2019, something happened in Texas. Can you talk about that?
So 2019 is probably the biggest anthrax outbreak we've seen in my lifetime. I'm 30 years old, so my lifetime isn't necessarily as long as some of the potential listeners, but it may be the biggest one in Dr. Cook's lifetime too in Texas.
I'm a little bit older than 30.
Oh, come on now. Don't be lying to the folks out there.
No, you're still a spring chicken.
Yeah. No, but so 2019, there were, if you talk to different biologists, you get lots of different ranges in the estimates of the actual mortalities that were experienced. But in Texas alone, we had an estimated 10 to 12,000 mortalities among livestock and wildlife around the anthrax enzootic, kind of little anthrax triangle that we're talking about. That being said, there was only 25 total cases that were reported to the Texas Animal Health Commission, and that was a couple of horses, several cattle, several white-tailed deer, an exotic antelope, and I think one goat. But it's one of those deals where, when you look at anthrax, it's something that is extremely underreported on. Whenever an outbreak shows up, there's a couple of different reasons that we suspect. One can be verified, pretty easily, and that's that whenever you have an outbreak on a property, it doesn't take but one culture positive animal to verify, yes, this outbreak, among all these hundreds of animals may be caused by this pathogen. We've verified it in this one animal. You don't need to do a culture swab on every individual, that are all dying in the same time with similar signs, and similar timelines.
Right.
So that's one reason that we think there's a huge underreporting bias. The other big one is a lot of government distrust, especially in Texas, and that's becoming something greater and greater every day. But it's one of those deals where the management of the disease when it shows up is something that can be done whether you're a rancher or you're an experienced epidemiologist. I mean, they recommend that you burn the carcass, and ranchers know this. So those who have been around the anthrax area and have seen anthrax outbreaks in their lifetime know that, when it shows up, this is how you deal with it. So instead of reporting it, they just deal with it themselves and not want to deal with Texas Animal Health, the Department of Health, the CDC, things like that, because, what happens is they wind up in this quarantine period that I think, if I'm remembering right, is about 30 days. And it basically shuts down commerce on their ranch, and it makes their neighbors mad because a lot of the folks out there know that it's there. They're like, why did you go report it when we already know it's here? You're not helping us at all. It's not like it brings down any sort of favorable help. All it does is get folks involved that we don't want involved. And so there's a big group of hidden dynamics that plays into that. But 2019 was absolutely, despite only seeing 25 cases, there were thousands that died in that time period, and likely even more that were impacted that survived.
Let's go ahead and switch gears to vaccines. And there are anthrax subcutaneous injection vaccines available for animals, but of course, this is probably impractical for wildlife. Dr. Benn, can you discuss the commercially available vaccines that are out there? How do they work, and how well do they work?
Yeah, so they usually work pretty well right now for when they're injected. And usually, what these vaccines are is they're called live attenuated vaccines. And so that's when it's a live bacteria that is used as a vaccine, but it is not as infectious, dangerous, virulent, whatever word you want to call it. It's not as bad as the full blown or wild type version of that bacteria. And so specifically for the vaccine strain that we have for anthrax right now, what it does is there are a couple of different parts of the genetic code that anthrax has that in this vaccine strain, it's missing one of them. And so that one is a protective capsule that it makes. And it helps protect itself as it goes through the system. It prevents it from being killed by the immune system. And then the other part of the genetic code, which is just a small part of it, of course, there's a lot more that's going on than just these two things. They're just the main parts that make anthrax dangerous. And so the other part of that genetic code that this vaccine strain still has, it makes a series of toxins that can then go throughout the body. They can it's kind of a good way to think about it is like studying for a test. So like you give this vaccine strain that's still making these toxins, it's showing the immune system what it needs to be prepared for. It's letting it study this material so that later on down the road, when this animal is taking the test, which might be grazing out in the field in the hill country or something like that, that it's able to bring back that information and protect itself later on. So the vaccine strains that we have and the vaccines that we have currently are working really well, just only when they're injected under the skin.
Yeah. So why would an alternative, as in this case, a oral vaccine, be useful in wildlife? I mean, it sounds obvious, but for the audience that may not think it's obvious, Dr. Benn.
Yeah, oh, sorry, you froze a little bit. I just got the second half of that question. But an oral vaccine would be really helpful because for deer and other wildlife, they're not like cattle or other livestock species where it's like if you ring the dinner bell, they're going to come running. They're a lot more afraid of humans. Their reaction is to head out as fast as they can, run in the other direction. So when it comes to deer and just any wildlife we can get our hands on, we really can't, at least not easily, not with a lot of money, time, labor, so on and so forth. So that's where an oral vaccine would be really helpful. And essentially, it's kind of like just think about it as like a spoonful of sugar makes the medicine go down, hopefully. So if we can get an oral vaccine that works really well, get it into a bait, then we can just dispense that across various properties throughout Texas, throughout different parts of the country that anthrax is a problem in, maybe internationally as well, then gives them a little tasty treat that they can also get some protection from.
All right. So that in theory, that's the same as the rabies baits for the raccoons and like that.
Yep, exactly.
And then in countries where elephants and hippos are dying from anthrax, like in Africa, hopefully this would be applicable also, correct? Yeah.
Mm-hmm. Yeah, and also I'll just interject that, Dr. Nunez mentioned the outbreaks in the Panhandle. Well, in the historic area where they see anthrax every year, those ranchers, they vaccinate their livestock against anthrax because they know it's a good chance it's going to happen. But when that outbreak in the Panhandle, they were not expecting it, and no one was predicting that outbreak to occur. And so they had not vaccinated their cattle. And at that point, the cattle are out on the range. They're out dispersed literally over tens of thousands of acres. And so to try to gather those cattle, to run them through a chute to vaccinate them was just impossible. And so they actually approached us, hey, we've heard about this oral vaccine for wildlife. Could we use it in cattle? Well, yes, but except it's not developed to that stage yet. But if it was developed to that stage, then clearly in those kind of bizarre outbreak situations, it could also be useful for livestock.
Yeah, good point. Let's talk about the paper now. And of course, the big breakthrough was the oral vaccine produced an immune response in white-tailed deer. And according to the Texas A&M press release recently, it states turning a vaccine meant to be administered through the skin into an oral treatment is not a simple process. Dr. Benn, can you talk about the difficulties in this process? Why is it so difficult, and what was done to resolve it?
Yeah, I feel like I was given all the hard questions to answer. But
did that on purpose.
yeah. Oh, thanks. I'm glad I know what I'm good for in this little group. But yeah, there was definitely a lot of difficulties. Putting aside my own pain and suffering and frustrations of lab work that didn't want to work. I guess the biggest one is when you're making an oral vaccine, what you have to overcome is something that has gone through thousands of years or however many years of evolution to prevent bacteria from getting into our system. So the biggest thing for making an oral vaccine is getting it to survive the stomach. And so, if you think about it, if you have a snack or a salad or something from a bad restaurant that has some sort of germ on it, you eat it, a few hours later, your body doesn't like it. It wants it out as soon as possible in whatever way possible. So we're trying to figure out how to get the body to not react to our vaccine in that way, because we still want it to be in there to essentially distribute that study material, going back to the analogy I made before, to get the immune response going and protect it later on. So what we did was we partnered up with Dr. Allison Rice-Ficht, and she had made an oral vaccine for brucellosis previously. So we kind of used that same type of formulation, just adapted it for the anthrax vaccine strain. And so I guess the best way to possibly describe it is if you go to a frozen yogurt bar, there's a bunch of those little gel bubble ball capsule thingies. Mm-hmm. I don't know actually what they're called or what they even market them as, but those little things, if you put a whole bunch of, what we did was we got those things, made them in a way that we packed them with a bunch of this vaccine strain of the bacteria, and then we administer that or feed it to either mice like I did for my dissertation research, or later on when I was working with Dr. Nunez, we started working with it in deer. So you feed it to the deer, and then it kind of acts as a kind of a gumball machine like you might see in a shopping mall, where you put in a quarter and it gives out a gumball. So the little gel balls are filled with all this bacteria, gradually releasing the bacteria as a gumball. And then that helps the immune system to get the study material that they need, but it also prevents the gastrointestinal system from completely rejecting it and getting it out as quick as possible, or just killing it. So yeah, I think that explains it. Hopefully, if there's any follow-up questions, I'm happy to go over it more.
Okay. Well, I did want to follow up with the fact that the animal is ingesting it in the spore form. Did that affect the production of a vaccine? Did it make it more difficult? Yes.
That was one of the fun difficulties that I had, that things went wrong, because I would find that as I started making the vaccine, it would germinate, which meant that it would turn into the vegetative form, which is not as stable. And so then that would be more susceptible to killing by the gastrointestinal system. So it was how to keep it in the spore form, in the gel capsule, and have it go on its way.
Yeah, that's pretty cool. Dr. Nunez, I'm going to go to you and talk a little bit about the study itself. Can you talk about the methods and what were your actual findings at the end?
So to kind of start out with, we were using the formulation that Jamie had tried out and had some pretty decent success in mice with. But one thing that we were, kind of continuously running into is the difference between the monogastric system that mice have and the ruminant gastric system that deer and most other herbivores are going to have. There's not very many monogastric herbivores aside from equids and maybe, I guess, camelids or some sort of, they've got 2 stomachs, right? They're not not a room of 3. Yeah, they're not a ruminant, but they're not a monogastric.
Mhm.
So, when you've got that, the ruminants, they've got a lot more chambers that you have to make it through. And that some of their chambers are actually pretty neutral pH, which is about the same as the small intestine, which is where we want to get the vaccine to, because the small intestine is what takes up a lot of nutrients or pathogens or whatever it is that you're trying to get into an animal. You have to get it past the gastric system to the small intestine. And so a lot of what we were doing early on with these deer was trying out a bunch of different formulations similar to that Jamie had already tested in mice, just trying to kind of mess with the formulation minusculely to get it to where it seemed to work best. And so we had lots of different pairs of deer kind of doing not a crossover design, but just trying it out in deer and then giving them enough time. And if they didn't have a response, trying something else out and comparing that to the sub-Q vaccine. And, kind of going back to your question, how well does the vaccine work when it's given in its premier form? It seems like in whitetail deer and ruminant livestock, it's about 90+% effective. With one injection. With two injections, it's nearly 100% effective. So, that's kind of what the benchmark that we had to go off of, is we want to get it as close to that as possible. And we finally got a formulation that seemed like, there was one deer of two that were in the group that actually did have a response that was considered protective via an in vitro assay, where we more or less introduced the serum to mouse macrophages and then introduce the anthrax toxins into it and see if that serum has antibodies that will protect against the toxins that anthrax, is going to cause disease with. So does that answer the question?
Yeah. But how about you? What were your findings at the end? Was there, X amount of deer that it was effective on, or?
So this original paper, if it's the one that I'm thinking of, it was just basically a proof of concept showing that it is possible. So it was literally just one individual of two that were in the group. We had, I think with that one, we had 5 groups of 2 that we were trying different vaccine formulations with. And that one with the proof of concept was just showing, yes, this is possible, because, to our knowledge, nobody had ever had any sort of good response in wildlife.
Right.
There'd been folks that have darted the vaccine, given it intramuscularly, and had some success. And we had success with that also. I like to call it putting a Band-Aid on a bullet hole, because, obviously you can't go around and dart every wild animal out there. But if there's something that's extremely valuable, like a black rhino or a cheetah or a really high value antelope, it gives you a means of providing the vaccine where you don't actually have to have hands on, but you do still have to come into, some sort of realistic contact, in the sense that you've got to be close enough to shoot a dart at it. So yeah, that being said, these findings were, we just proved the concept that yes, we can vaccinate and get an immune response in whitetail deer via this oral vaccine formulation. And from there, we did several other studies, and a big study in whitetail deer using 35 whitetails, or no, I think it might have actually been 36, because there was one group of 6 and either way, it doesn't matter. 30 plus whitetails, and then another group with 30 axis deer, kind of doing the same style, just trying to show that it can be done in other wild ruminant species. But this one here was just solely for proof of concept, showing it's possible.
Got it. Dr. Cook, so what's next for this vaccine research?
Sure. Well, I think, as Chase was talking about, we had this preliminary study that's the one that's just come out, and then they've done some follow-up studies, and those will be published fairly soon, to indicate that we've got a formulation that we're pretty confident, under the right circumstances, can produce a protective response. But these are vaccines. At this point, we're just squirting this vaccine in their mouth just to see if through oral exposure we can get this response. So our next step then is to incorporate the vaccine into an actual food bait and have the animals eat it like they would in practice, in the real world.
Right.
So that's what we're looking to next. We're trying to get the funding to pursue that aspect.
So if you have success with all these different steps, does animal vaccines have to go through similar scrutiny as human vaccines? Is there an animal FDA for this?
Yes, yeah. So there's a Center of Veterinary Medicine that would have to approve it. And so that's ultimately where we would need to get, but we want to, it's one step at a time. And so I think our next logical step is to actually try to incorporate it into a bait that could be realistically used.
Okay, perfect. Well, I guess I'll just close out with this. Any final thoughts from any of our guests today?
I guess one of the other things that we've been working on, so part of the, Dr. Cook kind of mentioned it, that we're trying to get some more funding. And so getting funding is a little bit complicated because of how underreported it is. So we've gotten comments from some applications previously that there's not enough evidence that anthrax is an issue. So we're trying to find some ways to demonstrate that so that we can get more vaccine development funding later on. And then we were also kind of backtracking a little bit. And so one of the studies that we've been working on currently, I'm down at Texas A&M Kingsville, and I'm an assistant professor of research here. So we're working on another tiny kind of proof of concept study with the commercial vaccine that people have reportedly been trying to just pour it over feed and see if it works. And so we never actually tested that before. So we've gone back to kind of backtrack a little bit and say, if we pour this over feed it to deer, and still don't see a result, then it really doesn't work. So we really need to get an oral vaccine going. And so we are just about finished with all those tests and are pretty much seeing exactly what we expected, that if you pour it over feed, it does not get an immune response going.
All right, good stuff. Anybody else? All right.
Yeah, I think that's a good point. So it shows the value of this formulation that Dr. Benn and Rice Fick developed, a microencapsulation form that does obviously work, whereas just the straight vaccine as it comes out of the vial, if you feed that to them orally, it's not going to work.
Yeah, that's what I got out of it when I read it. Anyway, congratulations on this work. I mean, it's clearly very, very important work, and I want to thank you, Drs. Nunez, Benn, and Cook, for sharing your time and expertise today with me today. I appreciate it.
Absolutely.
Well,
Thanks
thank
for
you very
having
much.
us.
All right, take care.
All
Okay.
right, bye.